Hello everyone, this is Adrienne McConnell, Product Development Coordinator with Loveless Health Plan. I'd like to thank everyone for joining our webinar today. Today's webinar is being presented by Serena Lyons, Director of Marketing and Business Development for Loveless Health System. Serena will be giving us an overview of the system. And now I will turn the webinar over to Serena.
Thank you, Adrienne. My name is Serena Lyons. Thank you for having me here today. I wanted to give you all an overview of Loveless Health System, a look back of 2011 and what we have to look forward to in 2012, as well as all that Ardent Health Services has done in investing in the healthcare of New Mexico. We'll start with Loveless Westside Hospital. Loveless Westside Hospital was recently recognized as the only hospital in Albuquerque by the Joint Commission as a top performer on key quality measures. They recently received the 2011 Quality New Mexico Roadrunner Award, as well as voted one of top 50 best places to work according to Modern Healthcare. This is a great accomplishment for Loveless Westside Hospital because essentially, with all these awards and recognitions that they received in 2011, it is essentially the place where patients like to receive their care, as well as where employees love to work. Most recently, as far as additions and renovations go, Loveless Westside Hospital just recently opened our OB unit. It opened in February of 2011, and we were excited to bring this service to Albuquerque's West Side as well as Rio Rancho because we have not had OB services at this facility in over 14 years. And with the growing need of families and individuals of our West Side and Rio Rancho, we felt it was the best place to add OB services. We wanted to take the best part of Loveless Women's Hospital, which is the OB, and take it to Loveless Westside Hospital. We renovated the second level floor of the hospital and added 9 private LDRP rooms, labor, delivery, postpartum, and recovery rooms, and also included is couplet care, which essentially means that the baby gets to stay in the room with the mom while she is recovering after birth. So they're beautiful units, beautiful floor plans. Everyone receives a private room, so it has definitely been a great addition to the hospital. Also coming soon in 2012, hopefully this spring, is the addition of pediatrics unit. Loveless has not had pediatrics in any of its facilities in quite some time, so again, it made the most sense to bring this particular unit to Westside with all of the new families out there, young children. We are working with pediatricians for this particular edition, and we are excited to be able to provide private rooms with family amenities. And as I mentioned, we will have board-certified pediatric hospitalists on staff. We're targeting the opening for this unit to be at the end of March. Loveless Westside Hospital has also invested in reducing the wait times of its emergency room. As we all know, when we are faced with an emergency, time is of the essence. So while most ERs have wait times of 4 hours or more, Loveless Westside Hospital has decreased its wait times to seeing a provider in less than 30 minutes. So we've been able to advertise our wait times. Right now they're right around 14 minutes, which is great. So we're able to advertise this to families, to the community, so they know they don't have to wait in an emergency room for over 4 hours. We're able to provide this care and really work on the efficiencies of our emergency room to be able to provide this at such a reasonable time in under 30 minutes. Loveless Westside Hospital also recently added its bariatric program. We're looking at expanding our bariatric services to adding more in addition to the lap band. Lap band is currently the only service that we offer right now for bariatric surgeries, but we are looking into adding potentially the sleeve, which will be great. It's another non-invasive type of bariatric procedure. We really want to stay competitive with our hospitals in El Paso, as well as just recently St. Vincent added bariatric procedures, and they are offering all 3 procedures. So we want to stay competitive. We're looking to contract and work with providers who can do these procedures for our patients and members. Of course, quality is of our top awareness and top of mind, so we want to make sure that we roll it out safely for our members and patients. But basically, the bariatric program has been very successful. We're able to offer members and patients a reduction in their BMI. Most patients are able to get off of diabetes medication, high blood pressure medication. We offer pre- and post-op nutrition counseling. And all of the focus groups have been so successful. Typically, when individuals do get this type of bariatric procedure, they like to know that there are support groups available to work with them and to assist them. And the majority of individuals who do get bariatric procedure are very web savvy, they're very research savvy, so they've invested a lot of time and interest into this particular type of procedure. So it's important that they have the support that they need post-surgery and prior as well. Lovelace Women's Hospital has done a fabulous job over the last years of working its way through the quality goals and metrics and awards. In fact, Lovelace Women's Hospital just received the ZIA Award for Quality New Mexico, which is a great honor for the hospital. They too were also voted one of top 50 best places to work by Modern Healthcare. So Lovelace is so proud of our hospitals that have received this national award. Most recently to Lovelace Women's Hospital has been its Da Vinci robotic surgery procedure. This procedure was started at the beginning of 2011. We started doing procedures in about January. And we have 14 credentialed surgeons who perform less invasive procedures for hysterectomies as well as GYN oncology procedures. Again, less stay, less pain is exactly what people want and need when they are faced with needing these types of procedures. We also have added this Da Vinci robotic surgery at Lovelace Medical Center, which is great. Again, another investment that Lovelace has made in the community, having Da Vinci robotic surgeries at both our Lovelace Women's Hospital as well as Lovelace Medical Center. Our Natural Birthing Center at Lovelace Women's Hospital has been a beautiful addition to the facility. We have always been getting requests, and we've been doing our research on the number of women who have been and are interested in doing natural types of births. A lot of women want to do these procedures at home, or they want the at-home experience, but they don't necessarily want to give birth at home. So we are able to provide the best of both worlds. We're able to provide that in-home experience while being at the hospital. So should the mother need care or be moved to a higher level of care, they can do so at the facility. The units have queen-size beds for their partners to be able to share that experience with them. They have beautiful birthing tubs where the women can labor in the tub and give birth in the tub if they choose so. In fact, it's such a hotel-like environment. I recently ran into a father whose wife just had a baby there, and he said he kind of wanted to leave a tip because he felt like he was at a hotel. So that was really nice, and a really nice compliment. Lovelace is proud to be able to welcome Heart Hospital of New Mexico to its families of hospitals. We recently added in August the Heart Hospital to the campus of Lovelace Medical Center. We're able to dedicate this hospital solely to cardiology, cardiovascular, and cardiothoracic care. We offer 24/7 vascular coverage, including limb salvage, which this is a great service for individuals with such a high diabetic population in New Mexico. Unfortunately, so many people really run into having to decide if they're going to save their limbs or not for any type of procedure. And with this service, we're able to be able to work with the patient on some sort of a salvage program. Also, the Heart Hospital in the past, has really they used to be solely focused on cardiac care, and then they started worrying about their emergency service lines and kind of focusing on other types of services, other types of surgeries. This way, the heart hospital can go back. We've been able to provide to where they can go back to just caring for hearts, which is great because that's what they do best. Lovelace Medical Center also recently added the latest and greatest in cancer fighting technology. We added the Tomo HD system, the 21IX linear accelerator, and the 4D CT, as well as recently upgraded our Perfection Gamma Knife. All of these services really add to our cancer fighting technologies, and that's literally the bottom line. We have the most aggressive type of radiation oncology that you can find. We also have the most experienced physicians to go along with that equipment. We focus on really caring for the patient, making sure that they get the radiation to the particular parts of their body that they need. We're not doing harm to any other parts of their body. Also, by upgrading the Gamma Knife, we're able to treat multiple brain tumors in one treatment in as little as 2 hours, and the patients can go back to work within the next day or 2 days. So this is a great service for patients fighting any type of cancer, really. Our Tomo HD, 21IX, and 4D, we treat all types of cancers. And then for the Perfection Gamma Knife, we solely treat brain tumors for that particular device. Lovelace Medical Center is also the new state-of-the-art MRI for patients who are over 500 pounds, and this is a great thing for so many of our obese patients, unfortunately, who aren't able to get this type of MRI treatment. We do have the capabilities of treating patients who are over 500 pounds. As I mentioned before, we also just added the Da Vinci robotic surgery system, and we will be working with the majority of the 14 surgeons who are also all credentialed at Lovelace Women's Hospital, so it'll be a great transition for them. This particular device at Lovelace Medical Center will more than likely focus on urology services, so Women's Hospital can focus mainly on the GYN oncology. So again, Lovelace will be able to service so many different populations of individuals with this type of needing this type of treatment. Lovelace Rehab Hospital has just received its 6th CARF accreditation. We are so happy. We were originally accredited in 5 different CARF areas, and now we are accredited in 6, which is great. So most recently added is the Outpatient Medical Rehabilitation Program for children and adolescents. But you know, the CARF program has, and Rehab Hospital has come a long way because we are becoming a stroke certified facility at our other locations. It's great that we are able to offer stroke rehabilitation for brain injury as well as spinal cord. Something also interesting that we've added is our new Functional Capacity Evaluation Program, or also known as FCE program. And this is great for companies who are looking at hiring individuals, but they kind of want to test and see if they're able to carry the amount of weight that they need to carry, that they're able to do the job that is asked of them, and that they're able to handle it. So many times companies hire individuals who may not be able to do the job that employers are asking of them. And this is a service that we offer employer groups for a nominal fee, and you can contact the Rehab Hospital to find out more information. But it's a great service that organizations and companies can take advantage of because we evaluate, and this evaluation can be done at the work site or at the hospital. So again, you're able to determine if these individuals have the skills and have the ability to do the job that the employers are asking of them. Our Lovelace Pharmacy, we have 11 pharmacies throughout Albuquerque and Santa Fe, and we've been really happy to be able to offer our infusion pharmacy, which is starting in 2012, actually this spring. We're also able to offer medication reconciliation for our LMC patients with complicated prescriptions. And something also new, which has been very well received by patients, is the Meds to Beds program, which is bedside prescription delivery at our Lovelace Medical Center and Heart Hospital. So this is great. I mean, the last thing patients want to worry about is when they're discharged from the hospital having to run by Walgreens on their way home. This way, we're able to take their medications to their bedsides. And most exciting in the last couple of months has been the addition of Roswell Regional Hospital to the Lovelace families as well. This acquisition was just finalized February 1st. We are working on naming the hospital. It will be named Lovelace Regional Hospital, Roswell. So we're excited to be able to bring the Lovelace Family Services quality care to the southeast part of New Mexico. This part of New Mexico has been an area that really, unfortunately, we hadn't been able to dedicate as much time and effort and our services as we'd want to. By purchasing this hospital, we're able to expand our services. We're able to provide patients who need to be transferred to Women's Hospital for NICU services, to Heart Hospital for any type of a cardiac care procedure. We're able to expand our services that we offer here as well to Roswell. Right now, currently, we have about 30,000 members in the southeast part of New Mexico. So this will allow us to hopefully grow that membership population. The hospital is beautiful. It was built recently in 2007. So it's only 5 years old. It has 26 beds. The individuals in Roswell, I think that's what's made the transition so effortless, is that the employees as well as the community are excited and thrilled to belong to an organization such as Lovelace, and to be able to feel like they are being taken care of, and that Lovelace can come in and help be a community provider to the southeast as well as a community partner. Lovelace Health System also started its ACE demonstration project, and ACE stands for Acute Care Episode. And essentially what this is it's an award that was given to Lovelace by the CMS, Centers for Medicare and Medicaid, and it's a demonstration project that we qualified for because of our high quality performance measures in orthopedics as well as cardiology. So essentially what this means is, because we're able to work more closely with the provider, with the suppliers of the products, we're able to offer a bundled reimbursement to patients who get orthopedic or cardiac services. This is only for people or patients who are on Medicare only. So if they have an MA plan or a Medicare Advantage plan, unfortunately they cannot take advantage of this. This is strictly for Medicare only patients. So, but again, it's great. They work with a physician who works with Lovelace, and they get a reimbursement for having their procedure. And these reimbursements range anywhere from $500 for a hip or knee replacement, and can go all the way up to about $1,300 to $1,500 for a cardiac surgery or procedure. Lovelace Health Plan, I just want to touch a little bit on some of our products and services that we offer. As you all know, we offer for our commercial plans a complete HMO, PPO portfolio, as well as HSA qualified portfolios. We have really been working hard on our individual and family portfolios, and really what we try to stress on this is it doesn't necessarily just have to be for an individual. It can be for families. Oftentimes, people realize that they can get a better deal by kind of going out on their own. They don't necessarily have to get the insurance that their companies offer. So we want to be competitive, and I feel like we have been competitive with our rates for our individual plan. We also offer self-insured and ASO services. Our community health plan, our Salute, our SCI, as well as our Medicare program have been very successful. We really want to try to stress that we have a plan to fit every budget, every need. That's basically the bottom line when we are marketing our services, that we want to say, you need a plan for you, we have the plan for you, and we can make it in your price range. We're excited also that Loveless Medicare Plan has branched out into the Oklahoma area. So again, our qualities of services, our desire to grow, and our success in growing has really paid off because we're able to offer this Medicare Advantage plan to not only our New Mexico community, but now our Oklahoma community, and working with our Hillcrest family hospitals out in the Tulsa and Oklahoma City areas. Our provider network, we are so proud to be able to say we have over 9,000 providers, over 40 hospitals and 40 urgent care centers throughout New Mexico and bordering states. This is great because a lot of, quite honestly, when we've done our research and when we've done our usage and awareness surveys, the perception is that other carriers such as Blue Cross Blue Shield, those national type names have more providers, when in fact that's false. We are just as competitive when it comes to our provider network. So that's really an area that we want to push, that we want to focus on, is that we have a provider in your network, or we can work with you on that. And also partnering with our multi-plan and PHCS offers us the opportunity to have over 590,000 providers, 4,200 hospitals, and 68,000 ancillary care facilities. So we also contract with Optum Health for our centers of excellence facilities throughout the United States. So again, for our provider service needs, we have the plan that fits your need and your budget. As we all know, members and consumers pick a plan based on budget and providers. So we have that for members. Some of our Healthy Steps programs, and Healthy Steps is essentially the programs that we offer for health and wellness. Our employer groups have become more and more interested and engaged in knowing about our health education programs. Quite honestly, I think in the past, none of our employer groups have taken advantage of these services. And it's also probably not really on the top of our list. As I mentioned, a lot of people pick their plan based on provider and price. The last thing they really care about has been our health and wellness programs, but we've started to see that change. We've started to see members becoming more engaged. We've started to see employer groups becoming more engaged, wanting to educate their employees on they want to save money. We can help our employers save money if we help them with their employee population get healthy. And we have the services and the programs that employees need to get healthy. And it doesn't have to be hard. It can be anything as simple from our Healthy Steps coaching to our Healthy Trails program, getting immunizations, our Stop Smoking program to our case management. Again, just as our plans have we fit every budget, we probably have a health program to fit every member's needs. So we're very proud to be offering these programs to our members, and we hope that our employer groups continue to take advantage of these programs. I just want to touch a little bit on the awards that we've received in 2011. Again, as I mentioned, we strive on providing quality service and quality health care to our New Mexico and now Oklahoma members. Really, I think that oftentimes the perception is that Loveless doesn't have the quality measures, or we've been not doing as well as our competitors, when in fact we have done so well. We've got national awards from Modern Healthcare. We were just recently recognized as a top-ranked PPO in New Mexico by NCQA. We were voted best places to work by New Mexico Business Weekly. As I mentioned earlier, our Modern Healthcare awards that Loveless Westside and Loveless Women's Hospital received, we were in the top 50. And so those, you just can't take those lightly. Again, our employees love working here. We are striving to provide quality care, and I think the awards speak for themselves. As I mentioned, most recently, Loveless Women's Hospital was recognized with the ZIA Award for Quality New Mexico. Loveless Medical Center is working with the American Heart Association on becoming stroke certified. We've received the Stroke Silver Plus Performance Achievement Award for those efforts. And Loveless Rehab Hospital and Loveless Women's Hospital were recognized in 2009 and 2010 for the Hospital of Choice Award. So we are making strides. We are being recognized not only on a local level, but as well as on a national level. And that's all I have for you all today. Again, if you have any questions about Loveless Health System, I'm happy to answer any questions. And I'm always open to doing further presentations with you all. So thank you for having me.
We're going to go ahead and open up the floor for questions. We do have one that's been posted on our site. Serena, if individuals want to know more information about the Loveless Health System after this webinar, where should they go for more information?
Individuals can always go to our website at www.loveless.com, and from there you can learn about all of our facilities and all of the services that we offer. There's also a link to Loveless Health Plan from the loveless.com site. And please, I encourage you, we've branched out into the social media world, so I encourage everyone to become a fan of ours on Facebook. We now have a Facebook page that we've started to keep updated quite regularly. We'll announce awards that we've received, events that we're doing. So I encourage you all, again, become a fan of Loveless Health System on Facebook.
Thank you, Serena, for that presentation. Listeners can view our listing of upcoming broker webinars posted on our Loveless Health Plan website under the Broker tab, as well as view previous webinars. Thank you, everyone, for joining us today, and have a great day.